Here we have an example of baby G, and baby G is admitted to the newborn nursery shortly after delivery, and that's represented by code 99460. However, the nursing staff notice her temperature is low and call in the neonatal nurse practitioner. And after the neonatal nurse practitioner examines the patient, she actually goes ahead and admits the newborn to intensive care for the use of the isolate and monitoring of her core temperature. And for that, she would report 99477. Now, the initial intensive care services are not reported in addition to code 99460, the admission to the newborn nursery. NCCI edits will not allow that. There's an indicator of 0. So you only, in this case, you would only report that higher level code, the 99477. The next day, we have baby G being stable overnight and still receiving intensive care. However, she's starting to bruise and her blood work is abnormal. She's shown that her liver function is poorly. She weighs 4,200 grams at this point, and further workup shows she's becoming hypoxic and she's transferred to neonatal critical care for intubation and ventilation. So in this scenario, the neonatal provider will report 99468 because this is her one and only initial admission to the neonatal critical care service. Again, a daily code. And the neonatal provider would not also report 99480 for that subsequent intensive care service, because again, the NCCI edits disallow this. The provider will report the highest level code of that day, which is 99468.